Welcome to episode 1375. Gong Ying, healthcare data and AI billionaire from China. 9 lessons. This is an outline of episode 1375, lesson 1 to 5. This is lesson 6 to 9. Lesson 1, she's very secretive and low-key. She was born in 1985, somewhere in China. She doesn't want you to know. She's probably from a very privileged background in China. She was sent to Moreton Hall boarding school in England. I find this very strange. She actually changed her name from Gong Rujing to Gong Ying. Lesson 2, she's a brilliant A student. Age 19, she entered the London School of Economics and Politics. At age 22, she earned a bachelor's degree in economics. 3, her philosophy of building the company, data plus AI.
Healthcare would be driven by data science and AI technologies. Those are two different things. AI technologies can be applied to many scenarios on top of the data infrastructure. We as a human in the world will have a much higher science understanding of human disease.
Lesson 4, this is her opportunity. China has a huge population and an aging population.
On one side, that we have a global aging population that 290 million elderlies in China now, and reaching 400 million in 2035.
Lesson 5, she only has 5% of the market share of healthcare data in China.
EY report, Yidu Tech is the leader in revenue among all healthcare big data solution providers in China, with a market share of 5%. This figure of 5% can suggest that the industry is highly competitive.
Lesson 6, her company is not yet profitable.
Revenue growth may be incredible. There is also a significant risk presented with their profitability. From 2018 to 2019, their loss incurred increased by 66%, and from 19 to 20, their loss was then decreased by 22%. They're still operating at a loss currently. This can be a warning for us as investors.
7, she has a long list of customers.
Target audience includes hospitals, pharmaceutical companies, medical equipment, research institutions, insurance, regulators, doctors, and patients.
In 8, she can help doctors and patients with AI.
Of the disease, we develop a timeline that helps the doctor to have a top view of the past 10 or 15 years. The machine helps to formulate the key criteria that the doctor needs to be focused on. So the physician can actually understand the particular characteristic of that patient in a second.
So 9, big data can help with clinical trials and drug development in the future.
On the supply side, in terms of drug development and clinical services, so a lot of infrastructure work that has to be done to make raw data enable things like clinical practices and drug developments.
Thank you for watching. Please subscribe and leave your questions and comments below. Wishing everyone peace and prosperity.